What if your memory problems aren't dementia at all? What if the pills sitting in your medicine cabinet right now, pills your doctor prescribed, are quietly stealing your mind? This is not a scare tactic. This is science. And millions of Americans over 65 are affected right now. Today I'm going to show you 5 common medications that can cause confusion, memory loss, and mental fog so severe, doctors themselves have misdiagnosed it as early Alzheimer's. Watch this entire video. Because point number 4 is something most doctors never bring up during a routine appointment. If you or someone you love has ever felt suddenly confused, forgetful, or just not quite yourself, comment yes below right now. A few years ago, a 74-year-old woman named Margaret was referred to a neurologist. Her family was devastated. She was forgetting names, getting lost in familiar places, repeating herself constantly. Every sign pointed to dementia, but her neurologist did something unusual. He reviewed every single medication she was taking. He found the answer in her pill organizer, not her brain scan. Within 6 weeks of adjusting her medications, Margaret was herself again, sharp, present, laughing with her grandchildren. Her story is not unique. This happens more than you know. Stay with me until the end, because point number 4 will surprise most people watching this right now. 1. There's a category of drugs most people have never heard of. They are called anticholinergics. Here is what that means in plain English. These drugs block a chemical in your brain called acetylcholine. That chemical is essential for memory and clear thinking. When you block it, even partially, your brain slows down. The troubling part? Anticholinergics are hiding in medications you use every single day. We are talking about common allergy pills, sleep aid you buy over the counter, even some bladder control medications your doctor may have prescribed. Brand names like Benadryl and Unisom fall into this category. Here's a scenario that plays out every day in America. You are 68 years old. You take a Benadryl for your allergies, maybe one at night to help you sleep. It has been working fine for years. But slowly, very slowly, you start feeling foggy in the mornings. You forget where you put things. Your family notices you seem a little off. And nobody connects it to that little pink pill. A major study published in JAMA Internal Medicine followed thousands of older adults for years. It found that people who regularly used anticholinergic drugs had a significantly higher risk of developing dementia-like symptoms. Some of those symptoms were reversible, but only if caught early. Look at every medication and supplement you take. Search the name followed by the word anticholinergic. Show your doctor that list at your next visit. Ask them directly, could any of this be affecting my brain? 2. Nearly 1 in 3 adults over 65 struggle with sleep. So it makes sense that sleep medications are among the most commonly prescribed drugs for older adults. But here's what the bottle does not tell you. Drugs like zolpidem, you may know it as Ambien, and benzodiazepines like Xanax or Valium can cause something called anterograde amnesia. That means your brain stops forming new memories properly while the drug is in your system. Some people wake up and simply cannot account for hours of the previous evening. That is not tiredness. That is a drug effect on your brain. Research shows that older adults who use these medications long-term have measurably different brain activity than those who do not. The confusion, the memory gaps, the disorientation, they can persist even during the day. Picture this. Your daughter visits on a Sunday afternoon. You had a normal Saturday night, took your usual sleep aid. But during her visit, you cannot remember what you had for breakfast. You repeat a question you asked 5 minutes ago. She goes home worried. She starts researching memory care facilities. All because of a pill. Drop a number 2 in the comments if sleep medications are part of your nightly routine. Never stop a prescription medication without medical supervision. Instead, ask your doctor about a sleep medication review. There are behavioral approaches to sleep, techniques with 0 side effects that work extremely well for older adults. 3. This one is important because blood pressure medications save lives. Absolutely they do, but certain types, specifically beta blockers and some diuretics, can cause cognitive side effects that look exactly like early dementia. Beta blockers slow your heart rate, but they also cross in the brain. One said they can cause fatigue, mental slowing, difficulty concentrating, and depression. Depression itself is one of the most common causes of dementia-like symptoms in older adults. Here is a real-world picture. A 71-year-old retired teacher starts a beta blocker for his blood pressure. 3 months later, he is not reading anymore. Crossword puzzles feel too hard. He stops calling his friends. His wife thinks it is depression. His doctor adds an antidepressant. Nobody asks, could this be the blood pressure medication? There are many types of blood pressure medications. If yours is causing brain fog, there are alternatives. Ask your doctor these exact words. Could my blood pressure medication be affecting my thinking? Can we try something different? That one question could change everything. Now we have covered 3 medications that can rob you of your sharpness. But the most important point, number 4, is something your doctor may never bring up during a regular visit. Most patients are genuinely shocked when they hear it. It is coming up right now. 4. This is the one that surprises people most. Proton pump inhibitors, prescribed for acid reflux, heartburn, and stomach ulcers, are among the most commonly prescribed drugs in the entire world. You may know them as Prilosec, Nexium, or Prevacid. For occasional short-term use, they are generally considered safe. But millions of older adults have been taking them daily for years, sometimes decades. And here is what is happening inside your body when you do. PPIs reduce stomach acid. That is their job. But stomach acid is also how your body absorbs certain critical nutrients, particularly vitamin B12 and magnesium. Vitamin B12 deficiency is devastating for the brain. It causes memory problems, confusion, personality changes, difficulty walking, even hallucinations in severe cases. And it looks, in every possible way, like dementia. The symptoms come on slowly, over months, over years. By the time someone realizes what is happening, the deficiency has been building for a very long time. If you take a daily acid reflux medication and have never had your B12 levels checked, please write that down right now. This is a simple blood test. It costs almost nothing, and it could explain symptoms you have been struggling with for months. Ask your doctor. I have been on a reflux medication for a long time. Can we check my vitamin B12 and magnesium levels? Drop a number 4 in the comments if you take a daily heartburn or reflux medication. If your levels are low, B12 supplementation can often reverse the symptoms, sometimes dramatically, sometimes within weeks. Margaret, the woman I mentioned at the beginning, was on a PPI for 4 years. Her B12 level was critically low. That was the answer. 5. Chronic pain is incredibly common after 65. Arthritis, back pain, nerve pain. The medications used to treat that pain, opioids like oxycodone, hydrocodone, and tramadol, are powerful, and they carry a serious cognitive cost that is rarely discussed openly. Opioids affect the entire central nervous system. They dull pain signals, but they also dull thinking, reaction time, judgment, memory. The brain cannot function at full capacity when opioids are present. In older adults, this effect is amplified. Your liver and kidneys process medications more slowly as you age. The drug stays in your system longer. It builds up, and the mental fog becomes more pronounced. Think about a 78-year-old grandfather managing severe knee pain. He is on a daily opioid prescription. He gets around, but his grandkids have started calling less. He seems different, slower, less engaged. Bless him. He is not becoming someone else. He is experiencing the neurological effects of long-term opioid use. This is not about judgment. Pain is real. Medication for pain is sometimes necessary. Ask about alternatives. Physical therapy, nerve blocks, anti-inflammatory approaches. Some people find that a combination of non-opioid strategies manages their pain adequately and gives them back their mind in the process. That trade-off is worth a conversation. Let's bring this home. Here are your 3 most important takeaways. Medications you have taken for years can quietly cause confusion and memory loss that looks exactly like dementia, and those effects can often be reversed. The 5 medications to discuss with your doctor are anticholinergics, sleep medications, certain blood pressure drugs, proton pump inhibitors, and opioid pain medications. A simple conversation with your doctor, using the exact questions I gave you today, could change the course of your health. Write those questions down. Bring them to your next appointment. Here is what I want you to really hear right now. You deserve clarity. You deserve sharpness. You deserve to be present for your children, your grandchildren, your friends, and yourself. Getting older does not mean accepting confusion. It does not mean surrendering your mind. Sometimes the answer is already in your medicine cabinet. And sometimes the most powerful thing you can do is walk into your doctor's office and say, I have some questions. Please share this video with someone over 65 who deserves to have this information. It could be a parent, a spouse, a neighbor, a friend. It can make all the difference. If this video helped you, give a thumbs up, subscribe to this channel. Every week I bring you health information designed specifically for people in their 60s, 70s, and 80s, clear, honest, and genuinely useful. And leave me a comment. Tell me, which of these 5 medications surprised you most? I read every single comment. Thank you for watching. Take care of yourself, and I will see you in the next one.